MediMergent has built and deployed a digital platform to collect ongoing information regarding newly approved medication and medical devices directly from patients. Sandra Garrett, founder and CEO of MediMergent, is a serial entrepreneur who has founded 3 companies.
Good morning. And so before I start, I have a question to ask the audience. By a show of hands, how many of you and members of your family who take prescription medication have concerns about the side effects? And second part of that question, how many of you, by a show of hands, watch a commercial on television every 3.5 seconds on every TV channel, cable notwithstanding, that advertises a medical product and gives you the side effect profile, and you say to yourself, what will happen to me? Show of hands. Well, that's our mission, all of you with your hands up raised. We provide you and members of your family with real-world data related to the risks and benefits of the drugs that you take. We have built a digital platform that's an early warning system to identify potential negative side effects of both medications and devices. Each year, approximately 77 new drugs are approved by the FDA, and they are approved with a limited amount of data about the safety side effects and overall efficacy. We don't know anything about the real-world effects until people in the community worldwide take that medication for a prolonged period of time. In order to have meaningful data, the information must come from you directly, you the patient. And so the question in the medical community and faced by our company is who's listening to your voice, or who's listening to the voice of the patient? We are. We have built the National Medication Safety Outcomes and Adherence Program to bring together patients and pharmacists and physicians to look at early warning signs of drugs for newly approved drugs and devices on the market. To date, we have recruited 10,000 patients from pharmacies and doctors' offices across the country. We enroll them in our HIPAA compliance study, and what we do works for the patient, their advocates, and their family. Patients complete digital surveys every month at home or at the pharmacy when they go to pick up their refills, or with the help of our call center. We then integrate the data from their medical records, their pharmacy data, and their claims data to provide one of the most comprehensive and robust profile of drug safety and efficacy. When the patient returns to the pharmacist then reviews the changes from the previous month's survey, and if there are any highlighted areas of concern, the pharmacist and the patient immediately reach out to call the physician. Patients participate in our program because they want to know how other patients, just like themselves, with the same profile, are reacting to the drug. As an example, think about the patient who says, I'm a Caucasian female, I'm 56 years old, I have atrial fibrillation, I have a history of diabetes, and I've had a recent heart attack, and my physician has put me on Xarelto. But every time I watch that television ad on Xarelto, and the ad says that I can bleed in my gut, or I can bleed in my head, I want to know how many patients like me have had a stroke by taking that drug. Our stakeholders are pharmaceutical companies, health insurers, physicians, and most important, you, the patient. For health insurers, we compare and contrast effectiveness of drugs and cost effectiveness of treatment. Also for the payers who want to know whether physicians are following the appropriate treatment. All the stakeholders want to track if patients are taking the drugs as prescribed. We develop models that can predict whether the drug works long-term or not, whether patients develop complications from treatment, and even if they will live long-term. Our business model, we make money from two sources. Number one, we customize data collection programs for our customers. In fact, we currently have a $5.4 million contract waiting for startup and several others in negotiation with pharmaceutical companies and payers. And number two, when our database becomes large enough, we'll sell subscriptions to access of the information. So, if you have atrial fibrillation, high cholesterol, or you take Remicade for your rheumatoid arthritis, in the upcoming months, you may be able to enroll in one of our programs at your local Harris Teeter, or your Shoppers Food Warehouse, or your Safeway pharmacy. The executive team is made up of 4 founders. We have known each other for years. We've all worked together in other healthcare-related companies, and all of us have had successful exits from the companies that we have developed. We raised $2.5 million to date, primarily from 35 physicians in this community who are specialists across multiple therapeutic areas. They serve as our consultants and bring significant validity to our products. We want to raise $5 million primarily to scale our technologies and to build a national program using disruptive technologies that genuinely serve the public health. We have a business model that projects a healthy return on investment. We have a management team who've been in the business for 125 years collectively. It's not me alone. With FDA as a partner that helps us to implement risk mitigation strategies by recommending our platform to biopharmaceutical companies and payers. The FDA as our partner turned out to be both our carrot and our stick. And we're working with companies such as IBM and Watson in anticipation of our exit. In terms of milestones and fundraising, the use of our funds are to scale the enterprise, to grow our staff and call center, to build disruptive analytics with IBM using artificial intelligence from Watson. We are really a first mover advantage, especially through our partnership with the agency and our physician consultants and our long history of work with pharmaceutical companies. And given the view of the current presidential administration, MediMergent really does have the wind in our sails. Our technologies will help to accelerate time to market, and our early warning system will reduce costs by keeping patients out of the emergency room and hospital. We thank you for the opportunity to address you today, and we hope that you will review our disruptive product and service not only as a viable investment, but as a system that empowers patients to be more vigilant about their health and disease. Thank you.